Christina?
Thank you, Matt. Women's Health Wednesday now. During this Breast Cancer Awareness Month, we know women are encouraged to get screened for breast cancer when they reach age 40 or earlier if there's a family history. But it could be more than one screening tool for some women that's needed each year. So let's get the details now from Dr. Lynn Choi, director of the Breast Care Center with Albany Medical Center. Thank you so much, doctor, for coming in once again.
Oh, happy to be here. So the designation is that every woman should get a mammogram at age 40 if you're asking a breast surgeon. So there's different guidelines for different people, but I say 40.
Yes.
And New York state law mandates that you designate the density of a woman. So density is how dense is your breast. So when you look at a mammogram, the more white it is, the more dense it is, so it's actually harder for a mammogram to see right through.
And that's why that ultrasound is that added tool.
Correct.
And so now, because of this designation, there
Correct.
are more women who will automatically have both mammogram then ultrasound, correct?
So,
or do they just go straight to ultrasound?
So it's really important for the patient to be educated, because sometimes your doctor may just order your mammogram. So when you get your result in the mail that says you have dense breast tissue, you should ask your provider, do I need an ultrasound? Typically, the younger you are, the more dense your breasts. As you get older, that density gets replaced by fat, so eventually you will not need an ultrasound. But I strongly encourage everyone to read their mammogram to see if they're dense, ask if they need an ultrasound, and then go from there.
Right, because you get that letter in the mail that says, okay, you have dense breast tissue. But don't rely on the provider to say, okay, we're going to do both, or you're going to get that ultrasound. We need to be proactive. Right?
Yes, the only thing that's a little confusing is there's 4 levels of density: really dense, in the middle, minimally dense, and not dense at all. So they will say your breasts are dense if it's any of the top 3. You really need an ultrasound if you're extremely dense and in the middle. So there's a little confusion because I have patients say, I have dense breast tissue, and then I go over it and I say you're minimally dense.
Right, but still, they ask and then you learn more.
Absolutely.
So important. Thank you for bringing that up. So let's talk about the fact that there is a particular group now where you're seeing a little bit of an increase in breast cancer.
Yes, so typically the majority of women who have breast cancer are postmenopausal breast cancer. Now they've seen a very slight increase every year, from 0.5 to 1% increase of women younger than 50. And the problem right now is that mammograms, breast imaging is recommended at age 40. We are seeing an increase in women younger than 40. So the most important thing I tell women is you have to get a clinical breast exam from either your primary care or your gynecologist at least once a year. And I tell women it's very important to be aware of your breasts. Know what's normal for you. Often try to examine yourself at least once a month, and be aware visually, like look in the mirror and see how your breasts look, lift your arms up, see if there's any dimpling.
It's important, and those self-breast exams, step 1, but step 2, like you said, you've got to go for those yearly physicals, and you said your primary care will and should do this, but also your OBGYN when you go see them, right?
So in this field right now, there's a lot of specialization. So a lot of primary cares are assuming you're gynecologist or vice versa. Just make sure at least one provider does a good annual breast exam on you.
Again, up to us though. We've got to ask, right? So if we go for that physical and we haven't been to the OBGYN, we need to talk to our doctor and say, I think I need a clinical exam here. All right, such important information. We appreciate you coming in as always. Is there anything else that you wanted to add? I know we could go on for a long time on this topic, but anything else that you want to add before?
Go to your doctor, be aware of your breasts, get your breast imaging.
Okay, appreciate you being here.
Thank you so much.
Thank you. And remember, for all of our resources and for our Women's Health Wednesday segments online, you can go to news10.com and look for Women's Health under the Community tab. We'll be right back.